main types of patients who come in to see me about breast augmentation. The first group are the younger patients, so women who have always felt a bit self-conscious about having smaller breasts and they can't fit into their clothes and they don't feel so confident on the beach, and they're classically 18 to 25. And then you see the group that are the mums who've breastfed children and they used to have, you know, better cleavage and fuller breasts, and then after breastfeeding there's been a lot of atrophy and they've lost a lot of volume, and they want to regain that confidence again. And then the last group is the more mature woman who, it's something that's been on the back of their mind for some time, but for whatever reason, often it's because, you know, their children, their partners, their job, everyone's come first, and then now they're in a position to actually put themselves first. The first consultation is about an hour long. It involves, you know, an in-depth discussion about what the goal is for a patient. So some people it's about trying to get larger volume, but a lot of people it's just a better shape, improved cleavage. Some women it's the upper pole, they want to fill up the upper pole of their breasts, and so it's really important to find out what sort of look you're trying to achieve. And so some people come in and they actually say, well, I want to look like Posh Spice. But at least we understand it, and the others are like, no, I want it to be really natural and subtle so no one can tell I've had something done, but I don't need to wear a push-up bra or padded bras to achieve that look. So once we understand what they're trying to achieve, then it's about trying to work out, well, what size change they want. And we've got to kind of marry that into what their existing frame and structure is. And so they put on a sizing bra and we try on different implants and they have a look, they take some selfies. We always encourage them that once they've narrowed it down to a couple of sizes, that for a weekend borrow a pair, they bring it home and we encourage it to wear it all weekend with everything so that they get used to how it feels carrying the extra weight, and that, you know, no one's noticing that there's a huge difference and they don't like that attention, or for some people they do like that attention. There's always risks with any sort of surgery you perform, but I guess the important thing to stress to patients is that, you know, breast augmentation involves inserting an implant, and that's a foreign body. And as great as the implants are today in terms of their quality and their warranties, nothing's fail-safe. And so they need to understand that, you know, they are putting in a foreign body, that it is recommended that after 10 to 15 years that it be exchanged, just like you change the tyres in your car. And in that regard, you know, with that comes risks of infection, of, you know, a capsule, which is a thick scar forming around the implant, you know, issues later with, you know, the sag that can occur with the volume and the weight. The typical recovery for a breast augmentation is, you know, at least a couple of weeks off work, depending upon what sort of work, you know, people undertake. So people who do more physical jobs, we'd say, you know, realistically probably about 4 weeks. But for those who return to more administrative duties or office-based duties, might be able to return after a couple of weeks. So the aftercare service that we offer is that, you know, generally either myself or my nurse will call the patient, you know, within the first 24 to 48 hours after surgery, just to see that they're okay. We provide medications for pain relief. We give all the post-operative instructions of the to-dos and not to-dos. You know, all the patients get, you know, the contact details for my nurse as well as for myself, so that if they need to call us at any point, that we're just on the end of the phone. And then we typically see our patients, you know, weekly for the first 6 weeks, and then we encourage them to come back at, you know, 3 months, 6 months, and then yearly. And largely yearly is more because having breast augmentation is a commitment long term. And so it's not just a matter that you get through the first 6 weeks okay. We want to make sure that, you know, you're not forming a capsule early, or there's a lump that you're worried about. And it encourages women to, you know, self-examine.